Good morning, friends. We'll be starting the instruction course on Accreditation Simplified, Improving Quality in Eye Care Practice. May I request the co-instructors, Dr. Chandrasekhar, Dr. Gagan, Dr. Samina, Dr. Arneja, to come to the podium. So you all know that accreditation has generated considerable interest over the last few years, thanks to the incentivizing mechanism by the insurance companies and of course from behind the government. You load the presentation? Okay. Right, this is on. So in this course we'll be covering, just don't start the timer, just introduction for a couple of minutes. In this course we'll be covering the important aspects of accreditation, and so basically many of us have concerns related to the infrastructure and what all licenses required for the accreditation part. And the major concern is the operation theatre layout and infection control process. My friend Dr. Chandrasekhar will be covering that. And the third topic is best practices in accredited eye hospitals. It's not only what we do in our hospitals, but we can also learn from other hospitals, try to copy and maybe upgrade them in our practices. And the fourth important aspect is the documentation requirement. Accreditation requires a lot of documentation. Some of us are not used to this kind of documentation. So that aspect will be covered by Dr. Samina Zamindar. And the fifth one would be the resources and how to prepare for accreditation. And that will be dealt with by Dr. Arneja. So these 5 topics, apart from that, we have enough time for a panel discussion. We'll take up your questions. I know there will be a lot of queries for people who are planning to go for this or in the process. So have your questions framed. So all of us will be happy to take up questions. So with this introduction, I'll just go to the first talk on infrastructure and licensing requirement. So why quality systems? Because our healthcare, they've graded many of the service industries and manufacturing industries, found that healthcare is in the 3rd position with the complexity of the system. So it's better to we ease that complexity so that people working with us and people coming for our service are comfortable with us. The first critical element in patient safety is the leadership, and most of us happen to be in that position, so we really need to know what we have to do as a leader. The first thing is decision making to go for accreditation, and accreditation believes on these 3 principles: structure, process, and outcome. So this was promoted by DONABEDIAN. So this is called as a DONABEDIAN triad. Structure is the infrastructure, the facility we have in our place. Along with that, people to give services and the technology and other aspect of infrastructure. Process is what happens in the hospital, the diagnosis, assessment, treatment, and the process of care. And outcome is what happens, whether it's negative outcome or positive outcome, surgical outcome or patient satisfaction. All these are outcome processes. So designing and planning infrastructure in high hospitals probably out of our medical curriculum, but you need to really understand why NIBH has included this. Basically to provide safe and secure environment for all the stakeholders. Comply with the rules and regulation of the country, otherwise very difficult to get license, and also plan for emergencies within our facilities. So it has not been separately or clearly identified in NABH standard about what are the requirements in infrastructure, because already many of them have been dealt with the other references. But the infrastructural requirement are basically interpreted from standards that are usually checked during assessment. Fulfilling these requirements may take more effort and longer time to complete for existing hospitals, but it's very easy now to plan a new hospital for those of you who have the resources for planning a new facility. And it's always having a checklist for all these requirements may help. These are some of the references based on which the standard guidelines were fixed. The first thing is your own health is a state subject in India, so the state plays a major role to giving regulations. The IPHS of Indian Public Health Standards, which classified according to the number of beds, is freely available in the net. We can download and go through. And the National Building Code. So here the hospitals are classified as Group C1 in the National Building Code. That gives all these guidelines. NABH is not really prescriptive about, and assessors don't come with a scale to your practice. So you just need to follow the National Building Code. Your architect or engineer will help you with that. And fire safety is an important aspect of infrastructure requirement, fire zones, the type of construction, life safety and additional occupancy wise requirement, all this are need of the hour. So infrastructure has to be in tune with scope of services. Don't copy your neighborhood big hospital or small hospital. Your facility is unique. You have your own scope of services, and all requirement may not be mandatory. So don't take the consultant's word as biblical word and demolish and add your structures. So see whether your scope of services and your facility are in tune with the requirement. These are some of the legal requirements with reference to infrastructure. You need to have a fire NOC, or for entry level you need to have a third party certificate. Building occupancy certificate, lift and escalators if it is there. For some states you need a lift license, and DG set pollution control board licenses. I'll cover that in the later. Take care of the fire hazards in hospitals, generators, inverters. These are some main areas where fire initially starts, computers. So you really need a good maintenance schedule to take care of the fire hazards in your facility. This is a requirement related to emergency situation. You need to have a codes practice that employees trained for emergency evacuation. Firefighting equipments have to be in place, and there has to be a proper transporting and emergency illumination system. You also need to have disabled friendly requirement. Most of our patients are vulnerable age group patients. So it's better to have a disabled friendly toilets and have an emergency department which is accessible to ambulance and wheelchair, and of course ramps and lifts in place. This has been the major concern for many of our ophthalmic practitioners. See to that you have a optimally designed OT in an inaccessible place or in a location where it's safe away from the OPD practice. See to that the space requirements are taken care of, and plan your OT for the next 5 or 10 years, not what you have now. So you also need to take into consideration the process requirement in the operation theater, medication management, patient safety and infection control. We have a lot of equipments in the theater. You also need to take those space requirement into consideration, and the number of people that would be operating or working in your operation theaters. Basically OT, you need to take care of the design and structure, the equipment and disposables, and also the maintenance requirement of OT. We'll be using a lot of chemicals and biomedical waste requirements, so you need to really take care of those. So basically the form follows function, and modular OT does helps to simplify the whole process of making your OT safe and patient safe. So basically a well-designed planned OT is a requirement legally for accreditation to reduce medical errors and also to have good control over your infrastructure. So can a building help you cure? Yes. There are green building concepts now coming up for this, maybe better for people who are planning your infrastructure. So these are some of the focus areas for hospital design: lighting, indoor air quality, housekeeping, biomedical wastage, landscaping, and of course sound reduction. So these are the benefits that is achieved by good hospital designing: 30 to 40% energy savings, faster patient recovery, less chemicals, and less maintenance. I'll go to the second part. I'll just give an overview of what are the licensing requirement for ICAS standards and entry level. Basically, it is a responsibility of management to get the licenses in place. It's part of this chapter 7, and this is the element. Those responsible in the governance lay down the vision, mission, values, as well as responsible for so this is how you have your vision, mission, and this should be linked to all your structure, process, and outcome. And there is a mechanism to regularly update licenses. This is one of the objective elements of ROM, and this is the suggested format. This format you can even get from NABH application, where there's a name of the license, the validity period, who is responsible for maintaining that license forever. So these are some of the applicable legal compliances. Biomedical waste management is absolutely necessary for healthcare institution, because we are all classified at orange, hazard, most hazardous industry as per the Pollution Control Board. So this is a must. The second aspect, the PCPND Act, at present it's only for B scan, don't get CAD, it's not for A scan. And PCPND Act, it is a necessary for you to have an ultrasound machine in your premises. It is not for the probe, it is for the machine. So keep this in mind. So, and register your B scan as a non-pelvic scan equipment. If you are running a pharmacy, Drug and Cosmetic Act registration and license is necessary. If you are using a lot of narcotics, your anesthetist will take care of that, but you need to have a NDPS registration, and with that comes a lot of stringent requirements and documentation for NDPS. And fortunately, we don't use a lot of narcotics in our practice. If you are having corneal transplantation facility in your hospital, you have to be registered under the HOTA Act with your state government as well as the iBank. And of course, all your doctors and nursing staff need to follow the code of medical ethics. So healthcare, basically, the legal requirement comes from three main sources: statutes, the regulations specific for healthcare, and regulation which are for other field, but it will also be applicable. For example, the income tax regulations. Case laws, these are basically based on the judgments, and of course, the code of conduct binds each and every one of us. So with that, this is just the overview of legal requirement. There would be some specific requirements, but maybe we'll be able to take up questions on that. With that, I conclude my talk on infrastructure and licensing requirement. If there are any questions, we can just save it for the panel discussion. We'll take one by one. Thank you for your patient hearing.